Let's start with something called inflammation. First of all, we'll be defining inflammation. So, inflammation is a response. First word that you need to tell, it is a response. A response of what? The response of vascularized tissue. Inflammation is a response of vascularized tissue. ठीक है, तो what you need to start with, inflammation is a response of vascularized tissue to response of vascularized tissue that deliver what? That deliver leukocytes and molecules of host defense okay, that deliver leukocytes and molecules of host defense to the site of infection and सेल डैमेज कहाँ पे, तो बोला जहाँ पे इन्फेक्शन का साइट है, जहाँ पे सेल डैमेज का, टू द साइट ऑफ इन्फेक्शन एंड सेल डैमेज in order to eliminate the offending agent. In order to eliminate the offending agent. Is it clear what is inflammation? Inflammation is a response of vascularized tissue that deliver leukocyte and molecules of host defense to the site of infection and cell damage in order to eliminate the offending agent. ठीक है, तो you just see how many words we are using only like response. What is this? It is a response किसका? The vascularized tissue का that deliver leukocyte and molecules of cell defense to the site of infection and cell damage in order to eliminate the offending. Clear. Now types of inflammation. So you must remember that there are two types of inflammation. ठीक है, one we call acute inflammation, another we call chronic inflammation. Okay, onset. Acute में it is very sudden onset. In chronic it is delayed onset. Duration, it is short lived, it is prolonged. Acute inflammation is very short lived. Chronic inflammation is prolonged. The cell, the classical cell of the acute inflammation is neutrophil. It is having 3 to 5 lobe normally, and here it is prolonged. Here it is lymphocyte. Cells are lymphocytes, monocytes and macrophages. Now lymphocyte जो है वो कैसा दिखेगा? So it will be large central nucleus with thin rim of cytoplasm. Can you see thin rim of cytoplasm? Large central nucleus with thin rim of cytoplasm. Monocyte, how it will appear? Cell with kidney shaped nucleus, that will be monocyte, and that monocyte one goes to the tissue that is called as macrophage. There is a word that is called plasma cell. Plasma cell is having eccentric nucleus, ठीक ना, eccentric nucleus, cartwheel shaped eccentric nucleus, perinuclear half. Why this is perinuclear half? Due to increase in the Golgi body. याद रखिएगा, you need to tell it out. Okay, why there is perinuclear half? It is due to increase in the Golgi bodies, and you have cartwheel shaped chromatin. The chromatin is cartwheel shaped. This is also called clock face chromatin. ठीक है. Now inflammation on the basis of fluid secreted, it is of 4 type. Okay, on the basis of fluid secreted. Okay, it is of 4 type. What are they? They are serous, fibrinous, okay, purulent and catral. CATRAL. Okay, serous, fibrinous, purulent and catral. Now serous is something fluid, simple fluid, clear and watery fluid. Pericardial effusion, pleural effusion, they will be seeing serous fluid, clear fluid. Fibrinous means they have thread-like consistency, and this fibrinous inflammation is seen in rheumatic heart disease. Okay, fibrinous pericarditis we tell. Okay, fibrinous pericarditis. So that the rheumatic heart disease we see fibrinous inflammation. ठीक है. Purulent is abscess formation. ठीक है. And catral is most common most important, there is mucus plus water, that is called catron. Okay, mucus plus water is there, that is called catron. Okay, next, now we'll be talking about something called the acute inflammation. So first of all, we'll be defining what do you mean by acute inflammation. So it is telling, okay, acute inflammation. So we are having a definition of acute inflammation. The definition tells what? So let's see. Acute inflammation has three major components. Three major components. What are the three major components of acute inflammation? The first, there is something called dilatation of a small vessel leading to increase in the blood flow. But before giving the definition, you must remember there are basically two type of changes being seen in the acute inflammation: vascular changes and cellular changes. Okay, and in vascular changes, the first change that you see, let me tell you that only. Vascular changes, if you will be seeing, in vascular changes, the first change is vascular changes. Vascular changes we are telling. The first change sequence is very important: vasoconstriction, vasodilation. ठीक है, देखो vascular changes तो VC, so we will be first writing VC only. Second, vasodilation, and third, increase in vascular permeability. Okay, and fourth, there is a stasis. Okay, a stasis. So we are telling vasoconstriction, vasodilation, increase in vascular permeability, and stasis is there. Okay, so what are the three major components of the acute inflammation? First, there is dilatation. This vasoconstriction is very first event, but it is a very transient phenomenon. Basically, it starts from the vasodilation. The first is dilatation of the small vessel. First process will be dilatation of the small vessel leading to, okay, dilatation of the small vessel leading to what? Leading to increase in blood flow. Okay, leading to increase in the blood flow, that is the dilation of the small blood vessel. Second, increase permeability of microvasculature, enabling the plasma protein and protein and leukocyte to leave circulation. ठीक है, increase in the vascular permeability causing the plasma protein and leukocyte to leave the circulation. And third, that is what? E-migration of leukocyte from microcirculation and their accumulation in the focus of injury, and then there is their activation and to eliminate the offending agent. Okay, then there is activation to eliminate the offending agent. Clear? So once again, e-migration of leukocyte from the microcirculation in the focus of injury and their activation to eliminate the offending agent. Okay, to eliminate the offending agent. Okay, fine. So this is there. What is the hallmark of acute inflammation? Increase in the vascular permeability. याद रखिएगा. This you need to remember. What is the hallmark? Increase in the vascular permeability. What is the changes? The VC we say, that's why vasoconstriction, vasodilation, increase in vascular permeability, and then there is stasis. Okay, what is the first process? That is the vasoconstriction. It is the first event. What? Very transient phenomena. This is vasodilation. There is a blood flow. Okay, and blood flow is like this earlier. Now that is vasodilation, because of which the blood flow has gone slow, which has produced the rubor, which has produced the calor. This is the point of inflammation. Okay, and major mediator of vasodilation is histamine हटा दो, both the vessel wall has been हटा दिया गया, that is dilatation. Then there is third, that is vascular permeability, with the hallmark of acute inflammation. It has caused you the tumor. You have rubor calor also, that has caused you the tumor. Okay, there are many mechanisms of increasing vascular permeability that will be also seeing. So what are the mechanism? First, let me tell you what are the mechanism of increase in vascular permeability. ठीक है, इंक्रीज इन vascular permeability का मैकेनिज्म क्या है? तो फर्स्ट इज एंडोथेलियल cell contraction, endothelial cell contraction या endothelial gap formation. तो जो this is there ना, so the endothelium, there is a gap formation and that leads to the, this is the most common one in the ventricle. Supplementary response is immediate and transient, and mediator क्या है, histamine and bradykinin. Okay, what is the another mechanism? Endothelial cell retraction mediated by cytokine. ठीक है. Endothelial injury, second. Endothelial injury, this can be mild, this can be severe. If it is a mild, like in a sunburn, if it is a severe, like in a burn, okay, if this sunburn, it is delayed and prolonged, and if it is a burn, it is sustained. Okay.